طيب Assalamu alaikum wa rahmatullahi wa barakatuh. So if you're watching this, you're probably part of a systematic review that I'm currently working on. So I hope by the end of this video, you might be able to understand what a systematic review is and also be able to carry out a systematic review by yourself independently. So we will start off with أول شيء defining what a systematic review is. So a systematic review is just like any other type of research. So in research, we have a lot of different study types. We have cross-sectional studies, we have retrospective, we have cohort studies, we also have randomized controlled trials, and then we have systematic reviews. So systematic review is basically a collection of different randomized clinical trials or cohort studies or retrospective studies or cross-sectional studies. Although most of the systematic reviews out there are actually collections of randomized controlled trials, you can still do a systematic review based on a number of cross-sectional studies or cohort studies, let's say. It provides a high level of evidence. And why does it actually provide a high level of evidence? The reason for that is that when you do a systematic review, you're basically compiling different research together in one single study. So you're basically building evidence upon another evidence in order to provide a clear overall conclusion at the end. And this is why you have this high level of evidence at the end. And then it supports the synthesis of clinical guidelines. The reason for that is that sometimes you can still have randomized controlled trials on a single on a single idea, right? But then you can also find out that one randomized controlled trial have ended up with a certain conclusion that is contradictory to another randomized controlled trial that has been also been conducted on the same idea. And so we try to do a systematic review and we try to do statistical tests in order to understand which of the two studies were actually strongest and provided a stronger evidence, and which evidence should we actually follow? Is it study A or B? And so based on the overall picture that the overall conclusion that the systematic review would provide at the end, we can tell a physician or a clinician who's working at the clinic that, hey, I think you should follow study B because their evidence is much more relevant than study A per se. So this is how systematic reviews are actually very useful when it comes to the medical field. And then they're systematic, they're not random. And I think that's very important to understand in a sense that systematic reviews actually provide clear questions and a clear question to study. And they also have clear inclusion and exclusion criteria. And this is very important to understand because there's a lot of reviews out there that are also reviews, but are not systematic reviews, right? They're kind of descriptive studies. And sometimes it's not the researcher's fault. Like you can't look at a review and say, oh, this is not a systematic review. So it's probably a bad review because the researcher did not know how to conduct a systematic review. It doesn't go this way. Sometimes you just cannot do a systematic review. Like in the early days of COVID, there was a lot of research, but the research itself was not very much standardized. So the researchers who wanted to actually provide something for people who were building up clinical guidelines were just not able to do systematic reviews with clear questions and clear inclusion exclusion criteria. So what was mostly done were descriptive reviews, but now it's a totally different story. So it depends on the timing, depends on the circumstances in which the review was conducted then, right? But it's always better, of course, to do a systematic review. So this is an example of a systematic review. This one systematic review, for example, was utilizing something called procalcitonin, which is an inflammatory marker. And they were basically trying to understand if using procalcitonin as a cutoff level for administering antibiotic therapy was a good option or not. And eventually they found no significant difference. So there was a lot of different conflicting studies. So they combined them all into this one whole systematic review. And eventually they were able to provide an overall conclusion. And this is what is usually done in systematic reviews. This brings up another question that's very, very important, which is what's the difference between a systematic review and a meta-analysis? So there is a lot of studies out there that are systematic reviews, but do not include meta-analysis. So is there a reason why a study might include might be just systematic review and not meta-analysis? Of course there is, because sometimes you just cannot do a meta-analysis. A meta-analysis, when we talk about a systematic review is basically you bringing up different articles. So say, for example, that there are 5 different articles, so you bring them all together and you try to take information from every single article and put it in, let's say, for example, one single table, in order to put these studies beside each other and say, okay, this study found conclusion A, this one found conclusion B, this one found conclusion C. But meta-analysis, from the name itself, it's basically the statistical part. Now, sometimes you might say, and study A actually did find out a conclusion, but they reported it in hazard ratio. And then study B also found a result, but they reported it in prevalence, let's say, for example. So sometimes you cannot really combine hazard ratio and prevalence, as far as I'm concerned, into one overall value. And this is why you might not be able to end up with a meta-analysis at all times. But for example, if they were both hazard ratios, you still can combine them into one single overall number or value when you run the statistical test. And I'm going to give an example in a minute if this is not clear. Sometimes you can have same values. So you can have, for example, risk ratios. So study A might report a risk ratio, study B might report a risk ratio, study C might report a risk ratio. And so you can theoretically combine them all into a single risk ratio if you run the statistical test. But however, you need to make sure as well, and these studies have followed the same inclusion and exclusion criteria relatively that does not affect the meta-analysis. So say, for example, that study A followed the patients for 14 days, but study B only followed them for, let's say, 3 days. There is a huge significant difference between 14 days and 3 days. So you can't really combine the same risk ratio and say, oh, those probably relate to the same population that was studied. And so I can have an overall picture. You need to make sure that the studies are also compatible with each other when you do a meta-analysis. So overall, always remember, in all systematic reviews are going to be systematic reviews, and all meta-analyses are going to be systematic reviews, but not all systematic reviews can lead to a meta-analysis. Right? I hope that it's clear at this point. I know it's a little bit might give you a headache when you think about it, but not all systematic reviews can lead to meta-analysis. Remember this sentence and you'll be good to go. Right? So this is how a systematic review would actually look like eventually. We have all of these different studies. Every single row of these is a different study. And all of these different studies have, all of these different studies have reported an event in here, right? And they also reported, and eventually through the event and the total number, they were able to provide an odds ratio. And so we plot this odds ratio from study 1 in here in this graph, and then the other odds ratio, and all of these different odds ratio. And so when we run the statistical test, what it's going to do eventually is that it tends to provide the summation of all of these different odds ratio on the graph in order to form for us this small dot in here. And based on this small dot, we can say that, oh, if it's less than 1, whether it actually favors PCT algorithm, procalcitonin algorithm, or does not favor procalcitonin algorithm. This is just an example. It can apply to any different topic. And you can have the 2 arms of the topic in here, or of the study in here that you're trying to study, and eventually you can base your argument based on this overall result in here. And then if you notice, there's something called weight. So I think everything in this table is clear. You can understand the graph, you can understand the odds ratio, you can understand the events and the total, and again here the events and the total. But something that not a lot of people might know is the weight. So when you actually run this test, when you run a meta-analysis, there is something called weighted meta-analysis, and there is something called fixed meta-analysis. What we mean by a fixed meta-analysis is that an analysis that actually provides weight for all of these different studies for the fixed one, in an equal way. So if you have all of these numbers eventually will add up to 100. So in a fixed one, you can have the 100 divided by 12 in here, which is the total number of studies. And eventually you're going to have 8.3% for every study. So the weight for every different study is different, is the same as 8.3. And eventually the small dots in here are going to be equal in size, right? Not one dot is going to be larger than the other, nor vice versa, لأن كلهم عندهم 8.3%. However, in this case, they did not decide to go with that. They decided to do something called weighted meta-analysis. The reason is that the weighted meta-analysis differs based على قد ايش انت عندك ال sample size. So the larger the sample size in the study, the higher the weight you're going to have. So for example, in here, the sample size was only, or let's take this one as an example. The overall sample size, I think we can see from here, was only around 200 something. But in this study, it was around 1,000 something. So you can compare that the weight in here was 21.4%, but in here it was only 2.6%. So the weight depends على the total number. It actually refers, يعني, it's way more complicated than that. It actually refers to the confidence interval in here. But the confidence interval, when you think about it, it also depends على the total sample size. But يعني, you don't have to concern yourself with that. Just know, and there is something called fixed weight, and there's something called weighted meta-analysis, and it depends on قد ايش الweight that is for every single study that is included in your analysis overall. So this is the theoretical ground. I think now we're going to move into how to conduct a meta-analysis or how to conduct a systematic review. I should probably say. So how to find an idea, look into prior studies, read. The more you read, the more you're going to understand studies that are conducted in one discipline, and the higher the chance that you're actually going to end up eventually with an idea. Also have a curious mindset. Whenever you read a paper, try to ask yourself, why didn't they do that? Maybe I can do it, or maybe I could replicate it, but in a different way. And eventually it will come, the idea will come. And once the idea comes, register it on something called Prospero. So if you Google Prospero, you're going to have this website that basically allows you to register your study on it. And why do we register our studies on Prospero? The reason is because usually, systematic reviews take a lot of time to conduct. And so we don't want better than two people to be working on a COVID study that might actually require them 12 months, only for them eventually to find out in both of them were working on the same idea, right? You want to كأنك قاعد تحجز فكرة لك عشان تتأكد إنه ما في أحد آخر قاعد يشتغل عليها، وعشان في نفس الوقت إنه جهود الباحثين كلها تتنظم يكون العمل يعني موزع للجميع. وما يكون في replication في ال ideas حقت research أو systematic reviews that are being conducted. So we're going to have this example of a research I'm currently working on in order to understand how to conduct a systematic review. So this research goes as trilaciclib as a myelopreservative in solid tumor treatment. So trilaciclib is a CDK4/6 inhibitor, and it's used as a myelopreservative. So what do we mean by myelopreservative? We know in the usually when patients undergo chemotherapy that they can have severe side effects, and these side effects arise because of the fact that you're basically kicking off all of their you're kicking off their bone marrow, and because you're kicking off their bone marrow, they tend to have immunodeficiencies. They can have febrile neutropenia and other complications that are related to their low WBC count. And so trilaciclib, it kind of tries to stop the kicking off of the bone marrow cells. So it tries to preserve these marrow cells, and that's the reasons, that's the name myelopreservative. And so we're trying to understand if trilaciclib is it actually effective and safe, or is it not, in the systematic review that we're currently conducting. So we're going to have this idea in order to understand the steps to conducting a systematic review. So how do we start a systematic review? I would say, and the most important thing is that you need to define your question. You always need to define your question. And you define it based on the PICO model. And the PICO model, I think we all studied it at med school. It goes as population, intervention, comparison, and outcome. So in the population, in the example that we've just went through, the population was patients who were undergoing chemotherapy, for the treatment of solid tumors. The intervention was trilaciclib as a myelopreservative, and the comparison was patients undergoing chemotherapy for the treatment of solid tumors, but were not on trilaciclib. And the outcome was hematological profiles and adverse events, right? So البوبيليشن اللي عندنا هم البيشنتس اللي قاعدين ياخذوا كيموثيرابي، والانترفنشن اجين هو التريتمنت المايلو بريزرفاتيف اللي قاعدين نسويه، والكومباريزن اللي قاعدين نحاول ان نقارن في اللي هم الكنترول جروب حقتنا، هم البيشنتس اللي قاعدين ياخذوا كيموثيرابي بس في نفس الوقت ما هم على ترايلايسايكليب. والاوتكم اللي نحاول نجد فيه الاجابه على سؤالنا هو الهيماتولوجيكال بروفايل. هل البيشنتس اللي اون ترايلوسايكليب هل كان عندهم a different hematological profile, different CBC count than the other patients who were not on trilaciclib or not. والadverse events طبعا if to determine if the trilaciclib itself was safe ولا لا. So after we define our PICO, we define our inclusion and exclusion criteria. So the inclusion criteria RCTs زي ما قلت لكم في البداية إن ال systematic review يعني should not be limited just to RCTs. So it can be conducted on cohort studies, on cross-sectional studies, and the list goes on and on. But for this example مثلا كانت inclusion criteria RCTs, studies on trilaciclib, studies on solid tumors, أو studies on patients using chemotherapeutic approaches. فما نبغى patients مثلا who are undergoing immunotherapy مثلا, or patients who are undergoing radiotherapy for the treatment of the solid tumors. We only want patients who were undergoing chemotherapy. والexclusion criteria طبعا أي شيء غير inclusion criteria. So and then you need to define your search. طيب فالآن حددنا الموضوع، حددنا الفكرة، عرفنا إيش الريسيرش that we want to work on actually. وحددنا الانكلوجن كرايتيريا. أنا الآن أحتاج إني أبحث عن سؤالي في PubMed، في SARC Digital Library، في Scopus، في clinicaltrials.gov. كيف أقدر أبحث عن my search and how do I make sure إن السيرش results اللي قاعدة تطلع لي تتضمن كل الأبحاث اللي I actually want to include. So أول شيء I define the keywords that I want to use. I define cancer, tumor, neoplasm, trilaciclib, Coxella, and G1T28. So cancer, tumor, and neoplasm, why do we have to use them all? لأنه مو كل الستديز ممكن تقول لك randomized clinical control trials يكون في عنوانها مثلا trilaciclib in the treatment of cancer. ممكن يقولوا trilaciclib in treatment of neoplasm, or trilaciclib in treatment of مثلا lung tumors. يعني eventually not all studies are going to have the word cancer in them. So you always need to include synonyms command for the other word. Same thing applies for trilaciclib. So you need to include Coxella, since هو it's another name for trilaciclib as well. G1T28 is also another name. So always include synonyms. How do we search? نحطهم كلهم under one category. So the synonyms are all going to be under one category. وبعدين نحط and. So find all studies that include either cancer or tumor or neoplasm and trilaciclib, Coxella, or G128. So the search will eventually show you all articles that include either at least one word from here and at least one word from here, right? So this is a good way to look for articles. And then you conduct your search. So where do I look up for it? Now and I know how to search. I know the keywords. I know how I'm gonna phrase my searching sentence in here. Where do I look? You look at Google Scholar, PubMed, Scopus, Directory of Open Access Journals, clinicaltrials.gov, and Embase. All of these are different choices that you can choose from. However, you don't have to look at all of them. يعني usually it should be appropriate if you only look at 3 different resources. You don't have to look at all of these different resources, but the more you include are the better. And the most important, I think, to include, to be honest, are Google Scholar, PubMed, and Scopus. But Google Scholar is sometimes very difficult to obtain articles from. We usually just do PubMed, Scopus, and we have one of these in here. One of these three also included. How do we get access to these? PubMed is open access, so everyone can access it. Clinicaltrials.gov is also open access. Everyone can access it. And you can access the rest of these resources from the Saudi Digital Library through your Blackboard account. So I think we just have a few slides and we will end. So after you look and you do your search using this sentence in here, you're gonna have an Excel sheet, right? You're gonna have different results, right? In PubMed, let's say. And so what you do is that you download all of these different search results using Excel, and there is a way by which you could do that. And eventually you're gonna have an Excel sheet that's gonna have all of the titles that showed up in your search result. And so what you want to do in here is that you want to do screening. So screening is basically the first actual step of your systematic review. And what we do in screening is that we exclude all of the unrelated articles via title and abstract. So sometimes even when you actually do your search, by the way that you did it, like the specific way that you thought was going to work, you're still going to have a lot of articles that are not related to your overall picture. So you need to go over the titles. So for example, if we take our study, the trilocyclic study as an example, sometimes you can still end up with studies that have used agents other than trilocyclic. So we need to look at the title one more time through the Excel sheet and try to exclude all of the unrelated articles, right? يعني تحدد عليها بالأحمر, you cross it out. So فيها الطريقة اللي أنت you're familiar with or you're most comfortable with. بس يعني eventually عشان إنك تتأكد إن كل ال articles that are not related are not included within your systematic review. And usually this study does not take a lot of effort. We usually end up with 200 to 300 articles, يعني article titles. It doesn't take that much time to go over these 300 titles and try to exclude what's unrelated. But then you need to download كل included articles, and you need to do something called full text screening. And then you exclude all of the unrelated articles after you do full text screening. So we do double check, right? We do initial screening using title and abstract, and then we do a second screening using full text. And then you do step number 8, where you basically do the data extraction. So now, finally, we have all of the studies that we want to include. We have them all as PDF, and we want to include them all in our research. And so we try to extract all of the data into different tables that we've already built before. So say, for example, that I was studying, again, trilocyclic, the myelopreservative, and I want to see the febrile neutropenia event rate. I'm going to build a table, and that table is going to have columns and rows. The rows are going to have the different studies, and the columns are going to have what I want to extract. Do I want to extract febrile neutropenia event rate? Maybe I want to extract command the CBC count. Maybe I also want to extract the 3 most common adverse events, the odds ratio for these, so the risk ratio maybe for these adverse events. And so I extract all of the data that I want from these papers, from these PDF files that I have into this table. And this is, of course, done manually. And then we also do something called risk of bias assessment, and I'm going to talk about it in a minute. And then number 9, we do the meta-analysis if it's feasible. Sometimes, as I've mentioned before, it's unfeasible. You can't do it. So we just don't do it. But if it can be done, you can do it. And there are specific programs by which you can do meta-analyses. So there is something called the RevMan. It's called RevMan 5. You can download it. You can see how it works. And you can do meta-analysis using that program. And eventually, you can do the manuscript writing. And we do manuscript writing using Prisma guidelines. And I'm going to talk about it, inshallah, within my last slide in this presentation. So this is how a table of data extraction usually looks like. we have different rows. Every different row has has a different study. And then we have the columns, and the columns has the information that we want to extract. So this was from a study that we did recently. We wanted to extract the design of the study, the period in which it was done, the mean plus the median age of included participants, sample size, including criteria, exclusion criteria of this specific research, and then concomitant treatments, etc. Yani there is a lot of variables that you extract, and they're different from one study to another based on what that study actually evaluated. And this is the risk of bias. Why do we do risk of bias? We do risk of bias in order to check whether the study that we are including in our systematic review is actually worthy of being included, or is it not? Is it of high quality, or is it of low quality? And this gives the reader an interpretation of how strong your systematic review is. So if your systematic review, for example, includes studies that are not that strong, the reader might not eventually depend on an overall conclusion that you have provided through your systematic review. Whereas another review that actually has strong evidence would be, of course, of greater quality than your research. And so for the risk of bias, we have different criteria, way more than these that I've included in here. But usually we do something called the CASP criteria. And I think this is with a C, not with a K. And we do Cochrane's ROP2. People usually do Cochrane's ROP2 because it's more visually appropriate. I think this is way more nicer than this table. So this table was built upon the CASP criteria, and this one was built upon the Cochrane's ROP2 criteria. At the end, they're both assessing risk of bias, but the CASP criteria is usually easier to do. But it depends على قد ايش الوقت اللي عندك, and based on the time that you have, you can choose which one of the two to go with. And this is the Prisma checklist. So this is just a checklist that shows you, basically teaches you how to write a systematic review. And while writing that systematic review, you can follow it to make sure you've included everything within the part that you're responsible for. So I think that's the entirety of my presentation. I hope everything was clear. I hope that everything was beneficial to you guys. And thank you all. And I'm sorry for the very long recording.